To stay up to date, don't forget to like and subscribe.
Within the communities right now, there are lots of people that are currently suffering with increased pulmonary disease and children struggling to breathe and asthma exacerbations. We are seeing all of that in these communities. Hello, everybody. Thank you for having me here today. My name is Dr. Vanessa Walker. I am a pulmonary and critical care physician with Pulmonary Medicine Associates. I practice mainly out of Sutter, Roseville, and in the electronic ICU for Sutter Health downtown. To make the ridiculousness of the environmental impact report really hit home, I was the first New Year's baby in Sacramento in 1982. So that report is as old as I am. And here I am standing telling you in front of you as a practicing physician. So we need more data, we need more updated information. But basically, the purpose of this presentation is to really make sure that everybody is aware of how incredibly dangerous this project is going to be for all of our health, okay? So what are we talking about? We're talking about the air pollution from the diesel particulate matter. That's the main thing. But what comes out of these diesel trucks? Carbon monoxide. You can die from carbon monoxide inhalation. It can cause headaches, various symptoms. Nitrogen dioxide, VOCs. The thing I really want to focus on are the particulates, the PM2.5. And those are the particulates that are generated by combustion engines and various other things in our environment that can dig deep into your body and cause a variety of illnesses or exacerbate, make worse, illnesses that you already have. So, next slide. Particulates, this is what they look like. These are the little alien, unfortunate things that we would be inhaling in our body. So, they look like nice little spears on reports from other places, but this is literally what they look like. These are digging into your body parts. Next slide. And to drive home how incredibly small these are. Grain of sand, we all know that's pretty small. Then compared to a human hair. Then you get down to the PM10, which is 10 microns in diameter, or less than 10. And those are the blue dots. A 2.5 is the red dot that you can see situated on that blue dot. That is how incredibly small these are, and that is how they get into every single part of our body. Next slide. So, when we're talking PM10, these are the coarse particles. These are still the particles that you saw that were ringed around a piece of hair. These can get into the upper airways, sinuses, cause nasal symptoms, drainage, runny nose, scratchy throat, watery eyes, things like that. And then can also get down into the bigger airways and cause bronchospasm, where the airways kind of tighten up. You move over to your 2.5, which is the particles that we're most concerned about, as well as the ultrafine particles. That's when you start actually getting into the lung parenchyma or the lung tissue itself. And then as it gets smaller, it's moving literally to every single organ, causing a variety of diseases. Next slide. So how are you going to see this stuff coming at us? What are you going to have symptoms? Very similar to what you all feel when we are exposed to wildfire smoke, right? You all know what that feels like when we're out here on these really bad air quality days. From a pulmonary standpoint, you're going to have shortness of breath, wheezing, some chest pain, extra phlegm production, coughing up more stuff than you normally do. For those of you who already have COPD, emphysema, asthma, this could mean more trips to the hospital or other complications of your illness. Cardiovascular, it can feel like chest tightness, chest pain, heart palpitations. For those of you who have atrial fibrillation, that kind of funny heart rhythm, it can feel like that. Shortness of breath, and then just generally unusual fatigue, just not feeling as good as you would like to. Next slide. So, as I said, every single organ system in your body is affected by these particulate matter. Starting at the brain, it can lead to reduction in blood flow. It can lead to decreased blood flow that can cause a stroke. And we see strokes increase during really severe air quality times. And the heart, it can cause worsening coronary artery disease. That's that development of the plaques and the buildup of cholesterol and other cells in our body on our arteries, making it so that you're at a higher risk of having a heart attack. And in fact, on really bad air quality days during the wildfire season, we do see an increase in patients presenting with heart attack just from inhaling wildfire smoke. Imagine what it's going to do to us that live along this road every single day. It can go down into our immune system, making our immune system weaker. It can affect your kidneys, and in those of us, or women here that are planning on having children or are pregnant, It can affect our babies in utero. It can actually lead to growth restriction, babies being born smaller, lower birth weight. That can affect them for the rest of their life. It can affect their ability, the development of their lungs. So this is something that is not only going to affect those of us in this room, this is going to affect the next generation and the next generation after that. This is going to devastate our community, as we are already seeing it happen in Southern California and other places where there are these large areas where they are just packing in warehouses and driving diesel trucks right next to all of our homes. Next slide. Children, this is our most vulnerable population in addition to our elderly population. But we always talk about the kids, right? Everybody wants to make sure that our children are protected. We're in this beautiful school, that's what we're here for. We see across the world that children are dying because of excess air pollution. So we don't want our children to be exposed to all of the air pollution that are going to cause things like stunted lung growth, impaired mental and motor development, behavioral disturbances, increased infant mortality, low birth weight, childhood cancers, increased risk of heart disease, diabetes, and stroke in childhood. So these are all things that we need to make sure that we prevent. Next slide. So I wanted to make sure you knew that this is just not my opinion. This is supported by literature. This one journal article up here at the top, which is from New England Journal of Medicine, shows ambient particulate air pollution and daily mortality rates in 652 cities. The reason I brought this article up is because it was looking at what happens to the actual daily death rate. You know, you've got death rate over a year, but what happens to the daily death rate of a city when there's really high bad pollution days? The actual, when they look at all the separate days, the daily death rate will increase. So this doesn't just affect long-term outcomes of cancer or other severe lung disease, but it can make people die on the days that you have really bad air pollution days. And then this study was looking at cancer mortality risk from long-term exposure. For every 10 microgram per cubic meter increased exposure to the PM 2.5s, that is the standard definition that we use across all literature looking at airborne or air pollution. For every increase in that we see, the risk of dying from any cancer rose by 22%. So, like I said, this really, I'm not trying to be, sensational. This truly is a big health concern for those of us in our community. And now I'm going to show you some more data looking specifically at, you can go to the next slide, looking specifically at this is the entire world. So every year, the World Health Organization puts out global burden of disease. Now this one is from 2016. They had another one in 2019, but the graphics weren't as good. But I want you to look at ambient air pollution, 4.09. Top 10 risk factors for premature deaths per year, 4.09 deaths in millions per year. That is just from ambient air pollution. So this is a big killer across our world, and unfortunately, in the most recent global burden of disease, this is one of the areas where we have seen an increase. So we're making improvements in a lot of other areas. We're trying to improve smoking. We're trying to decrease people's blood pressure. We're doing a lot of good things, but death from pollution from ambient air is actually increasing. So we are not doing a good job as a society, and obviously we don't want to add this to our local community. Next slide. So, brings us back to what's our situation here? Well, when you look at these traffic studies, or you look at information about how are communities affected by pollution that is from roads, diesel particulate matter, etc., you have to look at how close are the people to these roads. So if you're out in the middle of a cow field 50 miles away from any road, you're probably not going to be bothered by the diesel particulate matter. But what studies have looked at is if you are living within around 500 feet is pretty standard definition of too close. You don't want to be within 500 feet of this road. And a lot of will go out to 1,000. So between 500, I'm going to call that the red zone, 1,000, the not so good zone, living within these busy roads. So what makes a busy road? Well, we have to look at the traffic, how much traffic is going on that road. Pretty good definition that I was looking through, and in fact, I'm blanking on the organization that it's for the state of California, but the California Air Resource Board, CAR, California Air Resource Board, their definition of busy traffic is greater than a road of greater than 30,000 cars per day, or more than 500 trucks per day. Or 10,000 cars per day and 500 trucks. Well, when you look at the El Dorado County Road, they did a study in 2022 in October as well as in December. The counts on Latrobe Road are at 30,000 cars as you get closer to town center a day. And as you get closer down towards Royal Oaks, it's around 8 to 10,000. So we very clearly are hitting that mark of 30,000 cars. We will increase very easily of above 10,000 plus clearly more than 500 trucks per day. So Latrobe, if it isn't already, will be a busy road. So now we're going to be a very busy road, and we're going to add all of this diesel exhaust, not just cars. We're adding all this diesel exhaust. And when you look at what are the outputs from diesel trucks, they're 129 times worse than a car's output of particulate matter on roads. Not on highways. It's still significantly worse. I think it's 69 times worse than a car on a highway. But on a road, because you're stopping and accelerating, during acceleration, you put out more exhaust. What do you think they're going to be doing all day, every day on this road? They're going to be accelerating because we spend all our time on that road accelerating every day because of the traffic. You know, trying to get from here all the way across El Dorado Hills at 5 o'clock, you're stopping and going all day long. It's just going to get worse. So this is very, very real, and we meet the definitions of busy roads, which then leads me into our next step for literature, looking at what happens when you're that close. So, as I said, California Air Resource Board says homes within 300 feet, but significant impacts up to 1,000. American Lung Association says 1,500 feet. So we're looking at all these houses. There's these are all studies now. Reduced lung function in children within 1,000 feet, strongest within 300 feet. Increased asthma hospitalizations for those within 650 feet. Increased medical visits in children living within 550 feet. Higher risk of dementia for those living within 1,000 feet. CARB recommendation is to avoid situations that would place housing or schools within 500 feet of heavy roads. So that is the recommendation. So, next slide. Who's affected? Well, when we start up here by where Latrobe sits and their majority of the actual homes that are right along the way, yellow is 1,000 feet, red is 500 feet. So all those houses there are within the 1,000 feet zone. And then once you start getting down closer, those people in red, those are all homes that are going to be affected with the 500-foot zone. Next slide will show Blackstone. And the reason I don't have a lot of the other communities is simply because they're not close enough to that road. Now, I don't know about you, but we have lots of wind, and it tends to blow particulate matter farther away. So this is not just, I bring these up because this is by definitions for studies. But we all can use a little bit of common sense and know that this particulate matter isn't staying at 500 and 1,000 feet. It's going to keep going. So those, and forgive me, this is me drawing on, I'm a physician, I'm not an artist. Drawing on the red, people in the red areas, unfortunately a lot of us are in that red area. Those are the people that are most at risk. I mean, we have entire villages of Blackstone. The entire village is completely within that high-risk zone. And then my house is the blue dot, and I very clearly am sitting within the 1,000-foot zone. So we also, over here, have schools. This right here is John Adams Academy. Right through there, my daughter, when she went there, played right there. So very clearly, the kids, they have the playground right there, is going to be very clearly within that 1,000-foot range. So there are other daycares and other things as well as Marble Valley and all these other schools in that region. They don't quite hit within the 1,000 feet, but they're all still right close by. So that's pretty much the end of my presentation. I just wanted to take my expertise in health and what happens to people when they are exposed to these particles and just really drive home how incredibly important this is that we continue to band together and fight this with either our feet or our wallets or our mouths or however we want to do it. because at this point, this cannot go through. This simply can't go through. So any questions for me from a pulmonary standpoint? Yeah.
I don't have a question for that, but just on that map, I want to make the point of where you said your daughter played on the playground at John Adams. Next year, they're actually moving the elementary students to the building that is within the red zone.
Oh, great.
So it's going to be the younger kids that are going to be in that 500 feet zone rather than the 1,000 as well. So just wanted to make sure we were
spending more time because
yes.
they're going to be there longer.
So I'd love to connect you with John Adams as well to give some information that's there.
Sorry, just again with John Adams. So in that area below the school, they're actually building out their sports fields as well. So they're going to be
over here.
Yeah, right in there. They're going to be flooding up. Actually, if you took this slide and put the area where the parking lot is going to be, where the buildings are going to be, it's a pretty effective presentation piece.
Is there a date that they can get you to present this right away to the planning commission? Everybody knows to hear this.
I said I am available whenever Chuck asks me. I will make myself available.
You're awesome.
Yeah, absolutely. Chuck has my slides. You're welcome to share them. This is all public knowledge. Like I said, none of this is my opinion. I stole it liberally from various public websites.
So if you go to www.citizens4edh.org, we'll put it on there.
Thanks, Chuck.
And to answer the question about the Board of Supervisors, I'll extend it to the supervisors, and we'll see where it goes.
Quick question. Has there been any similar analysis done on communities with fulfillment centers?
Yes.
See whether or not they've seen the rise in cancer rates? I would think with disease registries and things like that, it would probably be pretty easy to see.
So that is a great question. I actually went and talked with, because I did a very similar presentation to the Placer County Air Resource Board, okay, the Placer Air Quality Board, about wildfire smoke. And the research looking, and I asked him, he used to work for CARB, and I asked him, hey, where's the information for these other places where they have massive fulfillment centers? Where can I get this information? He said that they have not, and I'm sure this is probably intentional, they did not collect data from the air quality prior to and after and have it readily available for public consumption.
But could you just take a look at the disease registries from before and after to kind of see a trend?
Yeah, so, and that we would love to do that.
That would be a more powerful argument.
Absolutely, absolutely. You have to get people with funding and research and et cetera to do it. And a lot of this is, I'm going to say it's kind of relatively new, right? 10, 15 years ago, we had no idea Amazon was going to be like this. We never even, this business park, never even in their right minds would we have ever thought a 4 million square foot building would exist. That was never even, when I bought my home here 5 years ago, and I'm looking out at my beautiful view, I thought, I'm going to see more of the same. Never did I ever think that would happen. That was just 5 years ago. So this is so new. I guarantee you we will start seeing this, but it's going to take years to see the long-term effects. But within the communities right now, there are lots of people that are currently suffering with increased pulmonary disease and children struggling to breathe and asthma exacerbations. We are seeing all of that in these communities with terrible, the Inland Empire is the worst air quality in the entire state of California. And that's where all these warehouses are mainly located. And so we don't want to turn into the Inland Empire. And once you get one in, more follow. And that's where we have to make sure we put our foot down, because once, horses out of the car, it's over.
So we have a YouTube channel, it's Citizens for EDH. This presentation is going to go up as its own video because I agree it was so impactful. If you go there, share the link to the Board of Supervisors in an email, and hopefully if you do that enough times, they will watch it. So even if we can't get her in front of the Board of Supervisors because public comment's too short, send them the video.
Thank you.
Thank you, Vanessa.
To learn more about citizens in support of El Dorado Hills, our fight against Project Frontier, and to donate to the legal fund, go to citizensforedh.org or find us on Facebook, Instagram, Twitter, and YouTube.